Hello, and welcome to Elite Medical Meaningful Use Made Easy, presented by Michelle Stevens. Michelle has been asked many times about meaningful use. What is it? Do I need it? Is it required? Etc. So we've decided to create a quick PowerPoint to share with you the basic information about meaningful use and how your practice can get started. Some of the most common questions we hear are, what is meaningful use? Do I qualify? I use a transcriptionist. I don't need an EHR program, so meaningful use doesn't apply to me. Is there a deadline? Is it required? With an EHR program, I won't need a medical biller or coder. So let's move on and let's answer some of these questions. Question number 1, what is meaningful use? Meaningful use is a technical term used by the ARRA, American Recovery and Reinvestment Act, to advance the process of electronic medical records across the nation in the medical practice. The main goal for the conversion of electronic medical records are for providers to appropriately, thoroughly, quickly, and share patient records. The ultimate goal is to allow all providers to have accessibility to any patient information in immediate need. For example, when a patient from Florida is on vacation in Belgium and suffers a heart attack, of course the patient would not have brought his medical records with him on the vacation. Without a complete up-to-date history of the patient, this is a slow way of being able to treat the patient. Yet if the patient was on network database that the provider had access to, and the patient's complete up-to-date history, the doctor can review recent labs, x-rays, or procedures and quickly be able to accurately assess and treat the patient. Next question. Do I qualify? Good question, and I'm glad you asked this question because this tells me that you're interested in meaningful use. To qualify for meaningful use, a provider must be in a specific specialty, which we will cover later, work with certified EHR program, have accurately trained staff, and be enrolled in one or two types of the incentive programs. Next question. Is it required? When is the deadline? Currently, it is not required. Medicare and Medicaid are currently paying providers a bonus lump sum check for each year they are enrolled in the program. There are certain criteria that must be met in a time of 40 to 90 days before you're paid your first bonus incentive check. However, the requirements set for meaningful use will be required beginning 2016. Providers not using an electronic records program with their practice management software will begin to see a deduction in their allowable payments from Medicare and Medicaid by 1% the first year and will continue to increase by 1% for each year thereafter. May I stress that this payment deduction will not be 1% from the lump sum of the payment, but for each date of service. So for example, Medicare allows $67.53 for an office visit, of which the provider usually receives $54.02. With the deduction, the provider's allowable will decrease to $66.85 and only be paid $53.34. At first, the amount is insufficient, but as you look at the actual full effect, this is how it will look for the provider. Normal EOB's total would be, let's say, for 12 patients times $54.02 would be a total of $648.24. Instead, with the deduction, the provider will only receive $640.08. Now multiply that by every payment times every month for the whole year, then let's try to figure how much that really totals to. The deduction is more prominent when you look at the total sum of numbers than just 1%. Okay, now let's move on to the next group of questions. I use a transcriptionist. I don't need an EHR program, so meaningful use doesn't apply to me. False. As I stated earlier, ARRA's goal is to create a complete database where all providers log in to view their patients' records from other providers. The field of transcription will eventually become obsolete. The EHR program will completely replace this service. Next question. With an EHR program, I won't need a medical biller or coder. False. I was shocked when somebody told me this. It's sort of funny how people can go from I'm very uncomfortable putting everything on a computer. What if the system crashes? What if I lose everything? Yet people will become so comfortable with the program once they start with it and come up with the idea that the computer program can replace the actual staff. That is really going from one spectrum and then completely over the edge of the other side of the spectrum, wouldn't you say? The EHR program is only and exactly what it is, an electronic health record. It is not your biller, it is not your coder, it is not your accounts receivable or your collection person. The only thing the program is meant for is for the input and output of data. The EHR will not have to have the complete knowledge of appropriate modifiers for the type of procedure performed. It will not have the ability to verify the status of a claim, to have a claim reprocessed, to verify and correct a denied claim. An EHR program will not be able to maintain or increase your bottom line or hold the insurance payer accountable if they underpay the provider for a service rendered. Nor will the EHR program follow up on outstanding patient balances, nor understand insurance contracts and fee negotiations, or the process of upcoming ICD-10s, just to name a few. The EHR program is meant only for the centralizing of medical records and for the creating of a streamlined and efficiently and more communicative medical practice. In this slide, we give a simple diagram outlining which specialty qualifies for Medicaid or the Medicare incentive program. If you or your provider services at least 30% of Medicaid patients, his or her specialty is a physician, then he or she qualifies for the Medicaid incentive program. If the provider doesn't see 30% of Medicaid patients and is a chiropractor and bills Medicare at least $24,000 a year, then he or she qualifies for the Medicare's incentive program. It's as simple as that. So, I'm sure the question of how much does the provider get has crossed your mind by now. And as you can see, the Medicaid incentive program, the provider will receive $63,750 and with Medicare $44,000. This incentive was meant to financially compensate the providers for purchasing an EHR program. I'm sure you are now wondering, how are the payments made? Here is a complete breakdown of how the payments will be allocated. As you may have noticed, that beginning 2013, providers' incentives begin decreasing with the Medicare program. I would suggest that for those providers that do not qualify for the Medicaid program, enroll in 2012 to maximize your payments. Here I've included a timeline of the history of meaningful use. You can review this later if you would like. Now, let's begin the evaluation of what is required for meaningful use. There are two objectives for meaningful use. The first is core objectives, which 20 of these items must be met to qualify for meaningful use. And the second is menu objectives, which 5 must be met to qualify for meaningful use. So let's first review the core objectives. And remember, You must qualify for all the core objectives to have meaningful use. Alright, as you can see here, we have broken down the core objectives by staff duties. Here you can see with meaningful use, it can become an automated system. There really are not any additional requirements outside the normal job description for each staff member within the current staff setting. Here's a list of objectives that should already be in process within all medical practices. The menu objectives are more than just the 5, but you can only select 5 to be able to qualify for the menu objectives for meaningful use. These are easy to incorporate in any staff setting and are currently available in most EHR programs. Now that we have reviewed all the meaningful use requirements, it isn't as cumbersome as you may have imagined. So why wait any longer and start receiving your bonus money? Here is some additional information that we have added from some answers and questions that we have heard and helped with providers regarding meaningful use. So now that we have completed our evaluation and knowledge of a meaningful use, why wait any longer? Start receiving your incentive money within 90 days. With Elite Medical, we offer physician services and a certified EHR practice management software. If you are interested in starting with meaningful use, give us a call. Just contact us at 801-569-1973, or you may visit us on the web at e-medonline.com. Thank you for joining Elite Medical and their presentation of Meaningful Use Made Easy.